Hi, my name is Chelsea Robinson. I'm going to be your OT doing your eval today. Could I get your name?
My name is Logan Robinson.
All right. Your date of birth?
April 13th, 1991.
Perfect. And why are you here today? You had a stroke.
I had a stroke. I had a stroke.
Okay, so you had a right-sided stroke, so you're experiencing left-sided weakness?
Yes.
Okay. I'm going to ask you a couple questions just to get some feedback on your cognition. What's today's date?
October 11th, 2024.
And where are you right now?
I'm in the Florida room of my house.
And who is the president?
Joe Biden.
Okay. All right. Cognition is good. Attention is good. I'm going to measure some of your range of motion right now. Could you please lift up your arm straight in front of you? Okay. Good. Oh, good. Okay. Could you please lift them out to the side? I see that left weakness demonstrated. Could you touch your head with both hands?
Yep.
Okay. Typically with a stroke, you probably wouldn't be able to.
Why you should coach me.
Let's see. Let me see your lower extremity. Can you bring both feet out in front of you? Okay. Could you bend your knees behind you? Nice balance, sir. All right, so your right upper extremity and right lower extremity is within functioning limits, but your left upper extremity is not. I'm seeing some limited range of motion, but in your left leg, it seems to be really good. Are you experiencing any pain there?
A little bit, but not terrible.
All right. I'm going to measure your right upper extremity strength now. So try to hold this in front of me. Don't let me push you down. Nice, very good. Same with the left. Just drop it. Okay. I'm going to have you sit in a chair and we'll do lower. It's not going to show it.
No, it's not.
Well, your right lower extremity seems to be intact and your left lower extremity seems to be intact based on a range of motion assessment. I'm going to measure some sitting tolerance and standing tolerance. So go ahead and stand up for me. Okay. Standing tolerance appears to be good. And go ahead and sit back down for me. Do you have any pain when you're sitting?
No.
No. I noticed a little sag on your left side. This view is not very good. Oh well. I'll have you stand again. So you're currently not doing any, using any adaptive equipment like a wheelchair or cane?
No.
How is your sensation in your right arm? Can you feel that?
Yeah, it's pretty normal.
How about in your left?
No, not really at all.
Okay. Can you feel this in your fingers?
No.
Okay. So left. What about in your right leg?
Yeah, feels fine.
Left leg?
Yeah.
Okay. How is your self-care going at home? Are you able to feed yourself?
Yeah, I'm right-hand dominant, so.
Perfect. What about toileting? Is wiping been difficult?
No? Yes? No, it hasn't. Sorry, I get confused with the question.
Cognition we might have to go back to. Upper body dressing. That's probably pretty difficult considering you only have one active arm.
Yes. Pulling on and off my shirt's a little more difficult.
Okay, I can teach you some strategies for that. And lower body dressing, how is it going? Having limited range of motion with your left hand pulling up your pants.
I make it work. I kind of do a little shuffle thing.
Good, I like the adaptive strategies. What about grooming? Since you're right hand dominant, are you still able to shave, brush your teeth?
Yeah, it's fine there.
Awesome. And then bathing, lower body and upper body. Are you having difficulty?
It's just a little more difficult washing, like mainly with my right arm. But
Okay. Muscle tone. I'm noticing no flaccidity in the right extremity, and it's looking a little flaccid in the left. Okay.
Oh wait, we just met. You think we talked about that?
Homemaking. How's meal preparation going?
It's fairly normal, but some things like cutting up a zucchini or cutting vegetables or
That would be
anything
hard.
like that.
I have some equipment I can teach you to use, like a rocker knife, an
Okay.
adaptive cutting board. Laundry.
Difficult folding laundry, in some instances, but
Okay.
I just use like a table or a couch kind of.
Good. I like your strategies. And are you taking any medication?
No, not currently.
Okay. I'm going to pretend to do your heart rate, O2, active and not active. What is your typical blood pressure usually?
120 over 80.
Okay, nice. And we're going to say that your O2 stats are normally in the 90s, like 98 for a typical.
Okay.
You're not experiencing any cardiopulmonary problems, are you?
No.
Okay. And then I'm just observing your static standing balance. And then can you go ahead and reach for that binder right there? I'm going to observe your dynamic standing. Okay, good. It basically just means like moving to grab something. Dynamic, static. And then your hearing. How's your hearing in your right ear?
What? It's fine.
Left ear?
Good.
So both ears are intact.
Yeah.
Okay. Other than that, you have. Oh, let me look for skin integrity real quick. Do you have any scars or wounds that I need to know about? I do see some edema and some swelling in this left arm because you're leaving it down a lot. And other than that, everything looks good. Thank you, Logan Robinson, for completing this evaluation with me. I'll get back to you with our goals and my notes later.
Thank you very much.